Okay, I just wanted to talk now about an issue around how you think patients or clients feel about you being there and you learning out there, looking after them. And, you know, I mean, you said earlier, Liz, about, you know, the medical students all round the bed, and, you know, how you feel about that. Or what about you when you're there with your mentor doing a skill? You know, what's your sense of what the patient's experience is?
I think that they're usually generally interested. When you say you're a student, just ask how it's going, and as long as you gain consent and do tell them that you're a student, they're usually fine, quite happy to help.
And I think that's the main difference that I've kind of witnessed between the nursing students and the medical students, is that whenever I'm in with my mentor or doing a practice, there's always consent. Even if I'm just there listening to what the nurse is saying, it's always asked if the patient's happy.
I agree that as long as consent's been gained from the patient, they seem quite happy. A lot of them really like the attention, and a lot of them say, "Oh well, you've got to learn somehow." You know, you get that comment, and generally, and I have had a couple say they didn't want me to watch a particular procedure, but that's fine. And you know, I would worry if they said yes when they meant no. But generally, you can tell that they like the attention.
I think as well, they don't feel pressured to have you there. I think that's what they say. They've got the right, and the mentor or the nurse that you're working with have always make sure that they are completely happy.
Yeah.
And if they're not, then you do kind of step out and just wait until they're finished. And I think that's a good point, that they are quite respected to make sure they are happy for you to be there.
Do you think in any way they do already or could contribute to your assessment of practice, i.e. giving feedback in your assessment document?
I think it'd be quite interesting to see what patients kind of think of you, because you do kind of go off and, if you're giving an injection, you explain to your mentor you're giving an IM and you're holding the needle at these degrees, but actually listening to the patient, how are we actually communicating with them and how they experience that. So I think that'd be quite an interesting feedback to have.
I do remember having a patient give me some feedback once and said, "Oh, you look very angry." And I don't know what I was doing, something new, trying to help her. And she said, "Oh, you look so angry, it wouldn't hurt to smile," kind of thing. And I felt a bit upset by that. But when I thought about it, I thought, actually, well, I'm busy concentrating. When you're concentrating, I realised that that's my natural expression for I'm thinking. So that really helped me to make an effort to sort of look calm and look like I'm in control. But that will help put the patient at ease then as well. Whereas I hadn't had that feedback directly from my mentor on that occasion. Maybe they didn't want to say, thought it was a bit personal. I don't know, but the patient actually said that to me directly, and I thought that was really valuable. So I think that would be good, to take that into account.
Yeah.